expecting as a result of this medication you're giving me. Okay. Doctors in Nigeria, please take note. Doctors all over the world, doctors in Africa, just try to emulate this good thing. Some of these people have done more harm than good. The patient is vomiting blood, spilling blood. This is a very, very terrible condition. Nurses as well. If you're a nurse, you go to your patient, you want to administer a particular medication to them, tell them, be nice and kind. Hello, 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 hello. Beautiful and amazing fans and followers of Obese and Lolo YouTube channel. You're welcome back to this channel. Yes, so today I bring you something so important I want to talk about today. There is something important to me and important to all of us, and I know you can't wait to hear this. It's something nice and wonderful, a great review, and yeah, it's something you must have been hearing. It's something you know, you're familiar with, but I just want to make a review about it. So I want you to get a clear insight and knowledge of what this particular condition is all about. You know, I promised you earlier that if you're among my community, I promised I was going to be dropping a health condition, like talking about our health. Of course, you know, your beautiful Lolo here is a nurse and a midwife, yeah, and for a long time now, I've not discussed anything pertaining to health. So today, I want to talk about our health because, of course, health is wealth, you know. And as we're living, making life and doing everything in life, we have to be mindful of what we do with our life, our health, because it's very, 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 very much important to us. That is why I'm sharing this great information today, making this review so that every one of us can take note of it. Okay? Yeah, stay tuned.
Now, before we go ahead, can you just listen to this piece of advice from the Aproko doctor, the one and only Aproko doctor in the worldwide?
So if you have stomach ulcers, here are 10 things that you should avoid. Number 1, minerals. Anything that does psh once you open it can actually make your ulcer worse. Number 2, coffee. Leave it alone. Number 3, leave atarado alone. All those spicy peppery foods, leave it alone. I know your destiny and pepper, they are together, but it's time to break up. Number 4, chocolate. Chocolate actually makes your ulcer worse. Number 5, there are certain types of fruits known as citrus fruits. Oranges them. They contain citric acid, which can actually make your ulcer worse. Number 6, alcohol. Some of you are already preparing your stomach for the level of alcohol that you are going to drink. Okay. Tomorrow night, you come to the hospital and complain that your ulcer is not healing. You are part of the problem causing it.
It's a lie.
Number 7, cigar. Smoking actually prevents blood flow and can actually make ulcers worse. Number 8, any drugs that are known as NSAIDs, ibuprofen, diclofenac, that fall into this class can actually make your ulcer not heal because they actually prevent the production of something that protects the inner lining of your stomach. Number 9, avoid too much stress. Stress can actually make your body produce too much acid. When it produces too much acid, your stomach ulcer might not heal properly. Number 10, see, you need to know what's actually causing your ulcer. For many people, it's caused by bacteria. The doctor will give you antibiotics and certain other drugs to kill the bacteria and reduce the stomach acid. Take it for as long as the doctor prescribed. Avoid all these things and your ulcer will heal. Pico.
Today, we're going to be talking about peptic ulcer. Yes, you heard me. We're going to be talking about ulcer. So what is ulcer? Ulcer is actually a condition that affects the lining of the stomach. Yes, anything ulceration, anything lesions affect when we talk about ulcerations, lesions, we are talking about like ulcers that affect the lining of the stomach. So when there is a sore in the lining of the stomach or there is a lesion in the lining of the stomach, this is actually what ulcer is all about. So when we're talking about this disease condition called ulcer, ulcer actually means like sores when there are ulcerations affecting the stomach lining. Okay, there are so many parts or places in this your stomach that the ulcer can affect. It can affect your esophagus where you have esophageal ulcer. That is ulcer affecting your esophagus. Okay, which is the the long pipe that connects from our throat down to the stomach. Then ulcer can occur in your duodenum. That is called duodenal ulcer. The duodenum is actually the first part of your stomach, of your small intestine. So this also affecting the first part of your small intestine. This also can also occur in your jejunum. Jejunum is the other middle part of your intestine. Okay. So now I've told you what the ulcer is all about. And I've mentioned the types of ulcer, which I said the gastric ulcer that affects your stomach, the esophageal ulcer that affects your esophagus, and then your jejunal ulcer that affects your jejunum, which is the middle part of the small intestine. Yes, of course, we also have the stress ulcer. Yes, stress ulcer. So when we go into depth of this video, you know what I mean by stress ulcer. Okay. So I won't just stop without letting you know what the cause of this ulcer is, which is the etiology of this ulcer. Ulcer is actually caused by a particular bacterial infection called the Helicobacter pylori, okay, which is the H. pylori, like people normally call it the H. pylori, is the common term for it. Yeah, it's actually a bacteria that affects the stomach lining, and then when the stomach lining is interrupted or is affected by this ulcer causing lesions and ulcerations, then somebody starts showing or developing the signs and symptoms of ulcer. Okay, then there are other things, like the most important one to me, and I want to emphasize on today, is another cause of this ulcer, which is the prolonged use of NSAIDs. If you're a medical personnel, you will know and understand what I mean by NSAIDs. NSAIDs simply means non-steroidal anti-inflammatory drugs. Yes, what are these drugs? We have the ibuprofen, we have the aspirin, we have the diclofenac. All these type of medications actually what trigger ulcer, especially the prolonged and chronic use of these particular medications. Okay, yes, and this is me today trying to point it out and call out all the doctors and nurses, especially in my country, Nigeria, and other African countries, where the doctors and nurses do not tell the patients or the clients what they are treating. Somebody will come to the hospital because of pain, of arthritis, pain in other part of the body, and the first thing they do, and other chemists, some of these chemists, yeah, where people buy over-the-counter drugs, which you just go to the chemist shop and then they give you medication. You're having headache, the next thing they give you ibuprofen, they give you diclofenac, without knowing your health history, without knowing your past medical history. Some of these people have done more harm than good. Yes, and this is me today calling out doctors, calling out nurses. Patients will come to your hospital complaining of one thing or the other. You don't know their past medical history. You will not examine them, and they can't even be open to you to tell you that, oh, I'm an ulcer patient, I used to suffer from ulcer. Before you know it, you prescribe ibuprofen to them, you prescribe diclofenac and every other NSAID to them, and this thing, just when they keep taking all this medication to relieve their pain, they develop ulcer, which is so terrible. Yes, lately and recently, my mother-in-law developed ulcer, and it got to a point that she even had a bleeding ulcer. What ulcer means, and then it has gotten to the point of like becoming a bleeding ulcer. The person is vomiting blood, stooling blood. This is a very terrible condition, and what triggered this for her? Because of the long use of medications, long use of NSAIDs. Yeah, she has been to the hospital. The doctor gave her some medications for pain, and then it resulted to bleeding ulcers for her. So this is me today. If you're a health worker, you're a health personnel, somebody comes to your hospital as a patient, just be kind and gentle, just the way we practice here in the United Kingdom. If I'm a patient and I come to you, you are treating me, you don't tell me what you're treating, you don't tell me the medications you're giving me, you don't tell me the side effects of the medications you're giving me. Absolutely, you're not doing me any good. You're doing me more harm than good. I need to know, I need to get insight of what I'm having, what you're treating me, and the medications you're giving, and even the side effects of the medication. What am I expecting as a result of this medication you're giving me? Okay. Doctors in Nigeria, please take note. Doctors all over the world, doctors in Africa, just try to emulate this good thing. Nurses as well. If you're a nurse, you go to your patients, you want to administer a particular medication to them, tell them, be nice and kind, and of course, it's a professional ethic for you to tell your patient, oh, madam, this is what I'm giving you. This is actually ibuprofen. It is for your pain relief and all of that. And one of the side effects is that it can cause ulcer, or it can trigger ulcer if you already had ulcer. Is it what you normally take? Are you happy to have this medication? Have you had it in the past? Did you have any side effect? Did you have any allergy to this? Yeah, these are the things we should do. You don't just give somebody medication without knowing their past medical history, without knowing what they're allergic to and what they can have and what they shouldn't have. So this is me today calling out all these doctors that do this. Yeah, somebody will come to the hospital. Of course, in Africa, because of the lack of knowledge, people are not very open, people are not very bold to say, oh, doctor, I used to have ulcer. Doctor, okay, look at, what are you treating me? People are not bold enough to ask you, oh, doctor, can you tell me what am I having? What am I suffering from? Can you tell me what you're treating? Yes, people are like, they're not very bold. Let me put it that way. Sometimes they're not very bold to ask you. They'll just be like, oh, I'm at the mercy of the nurses, I'm at the mercy of the doctors. They'll just give me what they know is best for me. It doesn't work that way. Please tell the patient, tell them what you're giving them, tell them what you're treating, and let them air their view. Let them give you their own opinion and what they think about everything you're doing to them. Okay, this is just one thing about medication management, and then it's just the right thing to do. So when your patients are not both like to air what they feel or what they can, like to ask you even simple questions to know what that being treated for. It's not nice. Just do anything you know. You're a doctor, you just prescribe medication and give to them, and that's all about it. It's not a good thing. And you, as a nurse, you're a nurse, please do the right thing professionally. Do the right thing. Tell your patient what they can have, what they cannot have. Okay. So I've talked about the cause of this ulcer. That is the etiology, which is the cause is the bacterial infection called H. pylori, and then other causes, which is the NSAIDs, prolonged use of non-steroidal anti-inflammatory drugs, which I've mentioned some of them. Okay. Then risk factors of this ulcer is lifestyle history. Yes, lifestyle. What are your lifestyle? Chronic alcoholism, chronic consumption of alcoholic drinks and all of that, and also your diet. Yes, which is part of your lifestyle. What are the things you eat? Are you so keen on spicy foods and all of that? Yes, prolonged use of alcohol, prolonged use of spicy food, and everything that can trigger this ulcer for you are the risk factors to this particular ulcer. These are just your lifestyle, which, of course, if you change your lifestyle, your symptoms of ulcer can go away. Okay. Another risk factor to this particular ulcer is genetic factors. Yes. And another thing is your physiological stress. Yes. Long-term physiological stress. Yes, physical stress. That is just all about it. These are some things that contribute to ulcer. In your lifestyle, are you a chronic alcohol consumer? What is your diet like? Are you a chronic spicy food consumer? So all these things are lifestyle, which, of course, if you do something good about your lifestyle, like try to modify or change your lifestyle, your symptoms of ulcer can go away. Okay, so let's continue as we progress to this particular disease condition. And I hope I'm making sense. I hope what I'm saying is like you're trying to get them and digest it in to know why you're having ulcer and to know some of the symptoms, what to do and what you shouldn't do about this particular disease condition. So let's continue. Okay, if you're still watching this video up to this moment, just give it a like, just give it a thumbs up. Okay, I have just one simple question to ask. You know, I mentioned about the stress ulcer, which is the physiological stress that trigger ulcer, which is one of the risk factors of this ulcer. You can just pause this video and tell me in the comment section, what do you think that is the relationship between stress and ulcer? Yes. Do you know the relationship, or what can you say is the relationship between this particular ulcer I'm talking about and then stress? How can stress induce ulcer? Just tell me what you think is the relationship in the comment section. We're just going to like talk about it. Okay. To continue, in my own way, I would say this particular physiological stress, which is long-standing stress triggering ulcer. You know, when somebody is stressed, you're physiologically stressed. You've been through a lot, you've been passing through a lot. One, you are going to have loss of appetite, and when you're having loss of appetite, you're not eating, you are starving. This is just going to trigger what we call an autoimmune digestion, like digestion. And you know, when the stomach enzymes are trying to digest enough secretion of hydrochloric acid, which is the acid, the stomach juice, when the stomach juices are working, trying to see food to digest, and they're not seeing any food in you to digest, this will cause what we call acid reflux, and then overstimulation and production of those acid looking for what to digest, and whereby these acids do not see what to digest, they start causing or triggering ulcer for you. Okay, so this is just like a connection between stress and ulcer. Yes, of course, when you're stressed, it shows on the whole body, your mind, your body, everything about you is affected. Yeah, that is why as a human being, you should avoid anything that will trigger stress, anything that will lead you to have a prolonged, long-standing stress. Just try as much as you can to do what? To reduce it. Now, let's talk about the management of this ulcer. To me, I'm going to classify the management of this ulcer into two ways. One, I'm going to talk about the acid suppression, and then this H. pylori eradication. Okay. First of all, let's talk about this acid suppression. When I say acid suppression, I'm just talking about suppressing all those hydrochloric acid, which is the stomach juices. Yes, we are trying to suppress them by giving antacids. So when you take all this Gaviscon, you take your Peptac, you are just trying to do what? Suppress the acid. Okay, which is acid suppression. You talk about what we call, your medical personnel, the proton pump inhibitors, which is your omeprazole, your lansoprazole. You take all those things to do what? Suppress the acid. Okay, then let's talk about the eradication of this H. pylori, which is another management of or treatment of this ulcer. Eradication of H. pylori is actually taking antibiotics to do what? To eradicate this particular bacterial infection that is causing this ulcer for you. Okay, the doctors can prescribe for you to have the triple action, the quadruple action, which is The triple action is just like a combination of two particular antibiotics and one of these proton pump inhibitors, okay, which is like you're taking two antibiotics and at the same time taking another medication to suppress this acid, this stomach acid. Yes, and then sometimes it can even go to the point of you taking a quadruple action. The doctor's prescribing for you to have three particular antibiotics alongside with a medication to suppress this acid, maybe one of the proton pump inhibitors. Okay. This is the measures to do what to manage your ulcer. It all depends on your doctor. So any health condition you're having, try as much as you can to visit the hospital. I know sometimes it's not easy, but you just have to do what's best for you. Okay. Sometimes you might just be asking, how is this ulcer diagnosed? Some of the things they can do for you is to maybe do a stool study for you. What am I saying by stool study? Stool study actually means taking a sample of your stool to check if you've got this particular bacteria in your stool. That is just what the stool study is all about. They can also do some endoscopy for you to know, depends on like the severity. Yes, because ulcer is not a good thing at all. They can do what we call the CBC for you, which is the complete blood count, to check your blood and everything to diagnose accurately if you're having an ulcer. Okay, so in all these things, how do you think ulcer can be prevented? Yes, simply you can prevent ulcer by doing what? One is to what? Modify your lifestyle changes. Let's say you consume alcohol a lot, try to reduce, try to, like, if possible, stop taking alcohol and see if your symptoms of ulcer wouldn't go away. Okay, try to like reduce your intake of spicy food, try to like be in control of your health, try to modify your lifestyle, do the best thing you can for your own symptom, because to be honest with you, ulcer is a very bad thing. It's not a good thing to experience, because you're not going to be comfortable. You are constantly feeling sick, you're constantly feeling reflux, you eat, you feel indigestion, you eat, the food is not going down, you're like as if something is still coming up from your throat. It's just reflux, because the stomach acid, there are too many that are trying to like come up again and you don't feel comfortable. So I would advise, as a health personnel, when you eat, try to do what? Stay 30 minutes sitting out before you go back to bed. Don't just eat and go to bed, because the acid will definitely come up again. Sit up after feeding at least 30 minutes before you lie down as a human being. Yes. Try to reduce your stress, okay? Try to reduce stress no matter what. Try to reduce stress and eat well. Modify your lifestyle, and definitely you will get better. You will heal faster. At the same time, try as much as you can to reduce the intake of medication, especially NSAIDs, especially all these painkillers, pain medications. Try as much as you can to reduce how you take these particular painkillers, because it's not doing you any good. It's actually causing more things for you, causing more problems for you. The least thing you can even think of developing is the bleeding ulcer, while you're now vomiting blood, you're spilling blood. You know, it's one of the complications of ulcer. Okay, and we don't want you to get to that point. That is why I'm bringing you this good review today, so that you can know and have a depth knowledge of what your condition is all about. Okay, and I hope you love this video. I don't know. I just hope you love it, because of course it should go viral. Yeah, videos like this should go viral when you're being taught of the needful, when you're being taught of what you should know. Okay, you're being taught, exposed to some of these disease condition that we see in a daily life. This is one thing you should know to help you. Okay, another thing you can do to help prevent this ulcer is doing what? Taking a prophylactic action. What is this prophylactic action? What I mean by this is like taking a preventive measure, like taking antacid. Let's say you start experiencing, oh, I'm being stressed this today, you just take antacid, take maybe one of your Peptac, or take your Gaviscon to suppress the reflux, and then you feel good, you continue, then avoid all the things you should avoid. Okay. Yeah, so let's talk about the complication of this ulcer. I've already mentioned one of it, which is the bleeding ulcer. The person is spilling blood, the person is feeling sick, you're constantly unwell, and then there is something we call stomach perforation. Are you going to be happy if your stomach is being perforated? You know what I mean? When the stomach is perforated, it's just like the stomach on its own, and then it's perforated, having holes here and there, making your stomach content to leak out in your abdomen. That is stomach perforation. And you know, when this condition has gotten to that point, it's actually so deadly. It's actually so bad. It means that your stomach is leaking. That is just like the term I can use to like address it. Stomach perforation simply means holes here and there in your stomach lining. Yeah, which is not good. It's going to make your stomach content to start leaking out in your abdomen, and you might be having surgeries to correct it. You might be having something so big, which of course you should do what? Try as much as you can to avoid this complications. Okay, I hope you love this review. I hope you love this video. If you do, give me a thumbs up and comment. I want to see you comment on this video. I want to see you share this video. You watch this video to this point, so what are you waiting for? Just hit that subscription button, okay, so that when I post the next one, you will be able to see my videos. I promise I'm going to be coming back here to drop more of this health talk, more of this health discussion, and I'm glad you will love it. Okay, I love you. See you all in the next one. Please share, like, and subscribe. One of your favorites, no, not busy. Okay, bye.